Nurse practitioners don't get a residency. Your first job is your residency. Your NP pal here. Welcome to another lesson from the tracks. All right, so today we're going to be talking about how your first job should honestly be treated like a residency. So, unlike doctors who get an additional 4+ years after they graduate medical school, or even RNs who get 3 to 4 months of preceptorship after you graduate, we don't get this at this level. And it's really unfortunate because it's school and then they throw you out there. There's no transition period. And so it's challenging because you're expected to be ready on day one when you may have not even had the best training. I remember they stuck me in some random primary care clinic. I actually did like 3 of my rotations there, and I was with this old 100-year-old doctor who had already retired twice. I think she was actually volunteering at this place. But she didn't care if I was there or not. Like, I left early or whatever, it didn't matter to her. So she wasn't really big on training or anything like that. I just had to kind of watch and learn, but it's very difficult. So no wonder there's stress in early career, especially that first year, because you expected to function like a provider who's been out here when you're still learning how to think. So for one, be patient with yourself, okay? Because I remember those difficult days going home, questioning everything, second guessing everything I did, feeling so dumb, like I didn't know anything. But it's not that I lack the knowledge, I just hadn't seen the patterns yet, okay? So patterns comes from repetition, all right? So the more that you see things, it'll become more familiar, all right? So think about it like this. So you starting out at urgent care, you may see 30 to 40 patients. So let's say you do that 3-4 times a week. I mean, by the end of the first month, you may have seen up to 500 patients. Your first 90 days, you've seen about 1,000 patients just in your first 90 days. And so that's actually quite a bit of people. And in urgent care, I would say more than half of those patients are going to be upper respiratory. So you're going to see a lot of strep, COVID, sinusitis, bronchitis, all of that stuff. That's going to be very familiar, and you're going to pick up on that pretty quickly. Even with the drugs that you use, it's usually the same kind of medications in the rotation. Cough medicine, antibiotics, inhalers, that kind of stuff there. So it just takes time, so definitely be patient with the process and yourself. I want to pass this on to you because my mentality then, I was not happy. I'm not gonna lie, I hated my first year. Apart because I was already used to making good money as an RN. Like, since my second year, was making about 100K, a little bit over that. So I was used to making good money. So when I first got my first NP job, I actually took a pay cut. Like, it was my first time being salary, and I was working more hours, more liability. I was working harder, and I just, I questioned everything. Like, why did I do this? Like, this is not fun. I didn't go to school for this. I thought my salary was gonna triple. So yeah, I was just not happy. But I also got thrown out there in the brutal flu season of 2017, 2018, if anybody remembers that time. Like, I started November 1st, so it was in the heart of it. So from November to probably March, it was rough. And I probably did an additional 30 hours per month of overtime that I did not get paid for. So it was very rough. Right. So again, I was mad at the entire situation when I should have just kind of been a little more grateful and focused on just learning and trying to get good for the most part. So of course there's going to be early career stress because you haven't seen the patterns yet. I mean, it's like you're expected to show up day one ready and to function like a provider, but you still learn how to think. So clinical confidence comes from pattern recognition. So the more that you see certain things, then it'll become more familiar to you. So you just have to stay focused, be patient with the process, be patient with yourself, and just know that, just treat it like training, okay? Especially your first 2 years, because that's really when you're kind of getting your footing and things like that. The money will come. It will get better. It's not going to be a significant exponential leap, but you'll have more opportunities, okay? Because if y'all have been searching for jobs, you'll definitely see on there where it says a minimum of 2 years. It'll be bolded, it'll be highlighted. Some will just flat out tell you, don't even apply for this job if you don't have this. I still tried, and some places won't even let you get past that first page. So just keep your head down, focus, try to learn, trying to get as much as you can, especially if you're at a really busy place. The thing is, you don't realize later on that place is preparing you. Like that urgent care that I worked at, it was almost 4 years. I learned just about everything, and it prepped me to be able to go and work in different places. So actually, when I left there, I went into the ER from the urgent care. So that place was definitely pretty good practice for me. So I think just approaching it like a mentorship, like practice, like a residency, okay? And it helps you. It really does, okay? So just stay focused with that. And just know that the more you practice, the more shifts you do. And not only that, I had that job and I had a side job. So I was working a lot. Like I probably did maybe 200 hours a month for years, actually. Like I've always had a side job. So I definitely got those reps in, and that it really makes you better, especially with time. And so you just learn because you've seen so many things, you've heard same stories kind of over and over, you kind of seen scenarios play out. So just be patient and stay focused, keep your head down, and just know that it will get better, it will get easier. Remember, clinical confidence comes from pattern recognition. For those who are out there 3, 4, 5 years, what was the most difficult thing about your first year? All right, guys, your MP Pal here. Practice boldly, and I'll see you on the next one.